RVA Today is made possible by today's sponsor.
Welcome back to RVA Today. I'm your host, Naomi Brackett, and today's sponsor is Chronic Care of Richmond, and we are so pleased to have Dr. Ben Hopsicker here with us. He is the Director of Community Education there at Chronic Care. And I would love to just start with the basics. What do you do at your practice, and what kind of people are you seeing there?
So our practice has been serving the Richmond community for almost 20 years, and we provide a non-surgical, non-pharmaceutical integrated approach to care. Most of the people who find us are usually coming to see us when they have histories of chronic pain, joint pain, bad arthritis, bad shoulders, bad knees, bad hips. These are people who have bone-on-bone degeneration, and they've been, frankly, dealing with these conditions for a long time.
Okay. Yeah, a very painful condition. You see a list of different kinds of conditions having to do with chronic joint pain and joint care. And you mentioned that you're doing this without drugs and without medication and without surgery, which are, the treatment options that are usually offered to people for this kind of really debilitating conditions. Tell me why it's important to your practice to do things a little bit differently.
Yeah, so our approach is really trying to address more the causative factors rather than the more reactionary factors. Surgery and pharmaceuticals have their place in healthcare, but unfortunately most people don't understand that there are often alternatives to help their body heal and recover that don't involve potentially surgical long recovery times, don't involve maybe only masking your symptoms with the pharmaceuticals rather than actually addressing the underlying causes.
Yeah, that's great. So people with back issues, hip issues, joint issues, what kind of treatments can you offer them that are not having to do with heavy drugs and medication?
Sure, so we actually have a bunch of different services that we offer at the office. We do, everything that we're focusing on is trying to help the body to heal itself. So we work with regenerative therapeutics, we have platelet-rich plasma therapy, we use class 4 laser, we use non-surgical spinal decompression.
Oh, wow.
We offer chiropractic care and rehabilitative exercise protocols. We're also really heavy on education, so we teach a lot about nutrition and weight management. We teach about understanding chronic inflammation. We have services for trigger point therapy. We have services for, general mobility and exercise habits. All of our goal is to help reinforce and build a strategy to allow your body to heal itself without side effects and long-term health consequences.
Yeah, that seems so important to really address the root cause of what's going on and not just treat the symptoms. And it sounds like you can help a wide variety of different kinds of conditions also. What are some of the results that you've seen from doing these kind of procedures?
Oh, it's spectacular. Some of my favorite examples are seeing people be able to get back to being physically active and vigorous in a way that they haven't been able to over the course of the last however long they've been dealing with these conditions. One of my favorite patients of all time was a chronic knee pain patient who has been able to get back out onto the golf course and be active in a way that he hasn't in forever.
Yeah,
his wife's mad at me because he likes golfing again and he's never home.
She said, you know what, maybe keep them slowed down a little bit. But that's great. Wonderful results. If people want to get in touch with you or with the team there at Chronic Care of Richmond, how can they go about doing that?
So we really highly value education, and as a result of that, we're consistently teaching community education seminars. We actually have another seminar coming up this coming Saturday, January 13th at 10 a.m. at our office. We're going to be talking about joint pain and mobility, who we are, what we do, and why what we do is different. The easiest way for you to be able to get a hold of us actually to do that would be to go to our website, chroniccareofrichmond.com, and sign up. There's a banner that they can click on to be able to sign up and come in, and we'd love to have an opportunity to teach you more about what we do.
Wonderful. Well, you can visit them online at chroniccareofrichmond.com or call the number on your screen. And I understand we still also have a free range of motion mobility screening, so you're definitely going to want to reach out. So thank you, doctor.
Thank you.
And thank you for watching RVA Today. We'll see you next time.